Hi, I'm Rob McIsaac, and I'm here today with
Jennifer Wernikowski, and I'm one of the nurse practitioners on C4 Hematology at the Juravinsky site.
That's been a real hotspot here, hasn't it? The stem cell transplants. Like, are more people getting cancer? What's driving that volume?
It's easy to be afraid, hearing that we have to do more, but actually the story is a good story. We have increasing indications to do transplants on patients, so we're pushing the envelope in lots of different ways. The most exciting thing is that now we have a way to find a match for patients who require an allogeneic stem cell transplant who couldn't get a match before. And that research really was largely led here in Hamilton by the team here at McMaster. It's called haploidentical transplant.
And it's very specialized, right? Like, there's not many places in Ontario that even do this work.
No, and we're actually one of only a very few in Ontario that do all the different types of transplant. So, it's a pretty unique service to have, and I think not only do we provide this service for, our own LIN, but we're a resource for the province for the kinds of transplants that we do.
Yeah.
Yeah, so it's a real honor.
Why don't we take a look around?
Sure.
So, Jen, tell me about where we are now.
We are in the apheresis room of the Oncology Day Services attached to the ward. This is the place where patients or their donors would have their stem cells collected.
So donating your cells, is that like a big deal? Is it hard?
Well, it used to be hard because a bone marrow transplant used to be bone marrow that would come right from the bone marrow of the patient, going to the operating room and having bone marrow extracted, which we still do rarely for aplastic anemia, for example, but most patients get stem cells, and so we can give the donor medications to wake up the stem cells and make more. We make so many that they get pushed out into the blood and they can just be collected from the vein. So you can see here that the blood basically is coming off, runs through the machine. The machine has the ability to take off the cells that it needs, and the cells will be collected in the bags that you see here. And then it will be basically separated into different layers. We'll be looking at the red blood cells, but also the white blood cells in the plasma. And those cells that express the protein that a stem cell has. When a stem cell is a stem cell, it has a specific area code, and we can pull those cells off specifically and put them in the freezer.
Well, I was really pleased to be able to spend some time with Jennifer talking about stem cell transplants here at Hamilton Health Sciences, and more particularly at the Juravinsky Hospital. I was so impressed with Jennifer, both in terms of her great technical expertise in this area, but it was also very clear in just talking to Jennifer and seeing the reactions of patients in the ward that Jennifer really treats the whole patient and develops personal relationships with the folks who are coming through. So very nice to see.
So, Jen, this is kind of an unusual area compared to the rest of the unit. Can you tell me about these rooms?
Sure. So these are our allo transplant rooms. Patients who undergo a transplant with cells from someone else really do need to be in isolation with positive pressure rooms. So that's what we have here. Positive pressure rooms are also great for patients who have low blood counts and a fever, even our auto transplant patients as well. But if we have 6 allogeneic transplant patients, they have to be in these rooms. So they're designed so that when you open the door, basically the air is pushing from inside the room out into the hallway. So that we won't push germs from the hallway and from this common space into the room. Yeah. So it's a positive pressure room. So each room has the door. It's always closed. Patients who've had a transplant will have signage on the door like this. We want patients to have visitors. That's a very important part of transplant, but it's important that we do it safely.
What made you decide to become a nurse practitioner?
I love working with patients, and when I was working in the cancer clinic for years and years, I worked with a radiation oncologist there, Dr. Tim Whalen, and we would be in clinic, and he'd say, I think you can do more. I think you could actually do more. Why don't you do this part and do that part? And he really took me to the edge of what I could do as a registered nurse, and I loved that. And so I thought, well, maybe I want to go the extra mile and do it. So I worked for a long time in the breast cancer clinics there. It was great, and I did do administration too for a while. But you can only do that for so long, 5 years, and then if you're not seeing patients, they will tell you that they will take away your nurse practitioner credential if you're not sort of doing clinical work, and I didn't want that, so I came back to clinical work.
So that patient contact was really important to you?
It's the best thing.
Yeah.
I think the stem cell program is something we can be really proud of at Hamilton Health Sciences. We're one of only 3 places in the province of Ontario providing this highly specialized care. It's a great example of the role that we play within the medical system as both, yes, a community hospital, but also very much a place that is doing state-of-the-art care for some of the sickest people here in the province. Also very interesting to see the really important role that nurse practitioners are playing on that particular ward. Of course, we've got highly specialized physicians who are leading the medical care there, but there's no doubt in my mind the nurse practitioner is playing an essential role in the viability of our stem cell program. So thanks very much to everyone in the program for hosting me, and especially to Jennifer for spending so much time, and hope to see you all again next time. Thank you.